want to address another terminology as regard baby and baby implantation. So this is what is known as premature implantation. So when you say an implantation is premature, what do you actually mean by that sentence? So premature implantation, this is a whole cycle of, the sperm comes to meet the egg where there's fertilization. Then the embryo now, which is the fertilized sperm and egg, have to travel back, all back into the uterus, which sometimes it can now implant the fallopian tube, causing an ectopic pregnancy. But when you say an implantation is premature, of course you are talking about an ectopic pregnancy. It occurred too quick, so it was out of sight, out of the normal site which is actually supposed to implant. So it just refers to what? The embryo embedding into the uterine lining earlier than the optimal window of endometrial receptivity. So it can cause a lot of pregnancy outcomes. Sometimes the pregnancy might fail. Do you understand? Sometimes it's implanting too quick that it didn't even wait to reach the uterus. It implanted around the fallopian tube. Okay. So implantation is a process by which a fertilized egg, that's a blastocyst, attaches to, then it will now invade the endometrial lining of the uterus. So it typically occurs between 6 to 10 days. Okay, that's a window of implantation. Okay, that's when the endometrium will be much more prepared to accept it. So anything earlier than this, you see that it's actually premature implantation. So premature implantation occurs when the embryo implants before the endometrium is ready for it. So this can disrupt the delicate synchronization between the embryo development and uterine readiness. It can lead to implantation failure. It can lead to early pregnancy loss. It can lead to poor placental development. Okay. So causes and risk factors is hormonal imbalance. Sometimes it's due to all those assisted reproductive technologies, endometrial abnormalities, stress or systemic illness. So clinical implications, reduced implantation rates in IVF cycles, increased risk of miscarriage, there's potential for abnormal placenta developing, which may actually now affect how your baby will be receiving nutrition and oxygen, which can actually cause a lot of issues. So diagnosis and management is, if you want to dictate it and really confirm, you actually do a test to see how the endometrium was well prepared. That's endometrial receptivity assays. Then hormonal support, then personalized embryo transfer strategies in IVF.